Hello guys. So now in the head and neck chapter, so let us go on to another subtopic, that is psychiatry. Okay. So disclaimer for psychiatry video is that please, if you can go to another video of someone else's or some other coaching app, please go through the psychiatry video of other coaching app, because here I've given only the important points. If you want to learn more about psychiatry and all, please go to the other apps and learn from there. And also please do the question banks. Okay, so whatever everyone has taught you, what I have observed is I've been through many different apps also. So what others have taught you, it doesn't link anywhere with the question banks also. In their own question banks, the questions that are coming up are not like very congruent with the teachings that they are doing. Okay, so it is all about the question banks and previous year topics that you should be discussing or you should be focused on with respect to psychiatry, because all that they are asking is the drugs, the side effects of the drugs, and what is the relationship between these drugs, where does the contraindications and all these many different drugs are there, and many different things are there with respect to the question bank questions. Okay, so that is why please, instead of going to any of app also, please go do the question banks of psychiatry. Okay, so that is the best way to learn psychiatry, is what I'll tell you. Now for the basics of psychiatry, I'll tell you, and this is more than enough for like just the basics of psychiatry is what I'll tell you. Okay, so in psychiatry, so there are two kinds of issue. Okay, one is organic and another one is functional issues. Okay, organic issues and then another one is functional issues. Okay, organic issues is nothing but the brain, the organ is involved. Okay, so brain organ is involved and it is causing the issue. Okay, so there are three kinds, that is delirium, dementia and amnesia. Okay, so if these three things are there, it is the brain that is involved, right? So that is how delirium, dementia, amnesia, all these things, the limbic system and all dopaminergic pathway in especially in brain is involved, right? So that is why the name organic organ, brain organ is involved. So that is why the organic issue in psychiatry, these are the two kinds of issues. Okay, then coming to functional psychiatric issue, so this is the thing, psychiatric illnesses. Okay, so functional issues with respect to psychiatry is psychiatric illnesses. Okay, so we'll learn one by one. So in psychiatric issues or the functional psychiatric issues, so there are two kinds. One is psychosis and another one is neurosis. Okay, so in psychosis there is schizophrenia and mood disorders. Okay, and mood disorders. In mood disorders, this mania, depression, bipolar, so this all depends on the mood of the patient, right? So this is where the pathologies are, right? So this is the correct classification of psychosis. Then coming to neurosis, it is based on the nervousness. Okay, so nervousness issues. Okay, nervousness issues and all will be in neurosis. Okay, that is why OCD, phobia, anxiety, PTSD, okay, acute stress disorder, all these things will come under neurosis. Okay, so this is the brief best classification that you can do with respect to psychiatry, so that you can know where exactly to put that particular disease. In the case, they'll be giving a case scenario and you should be knowing where exactly put that particular psychiatric illness into. Okay, so then you can go for treatment, that contraindications, side effects and all these things. Okay, so now this is after the classification. Now let us see what are the drugs that can be given, because that is the thing that they are focused on, right? So let us learn each of them. Okay, so for schizophrenia, it is the antipsychotic drugs is what we give, right? It is psychosis, so that is why we give antipsychotics. So in antipsychotics there are two kinds of drugs. Okay, atypical and typical type of drugs. Okay, you know this, right? Typical antipsychotics that we used to give in our psychiatry department usually used to be haloperidol, clozapine and all these things, right? So in atypical drugs, the important ones are clozapine and risperidone. Okay, please remember clozapine and risperidone. Okay, when it comes to typical antipsychotic, it is going to be haloperidol. That is very, very important. Okay, So remember these three drugs. Based on these three drugs only, they are asking many questions. Okay. So now let us see what are the side effects with respect to these drugs. Coming to atypical drug, that is clozapine. Clozapine is one of best antipsychotic. Okay, one of the best antipsychotics will be clozapine. Okay. But the problem with the clozapine is it has too many different side effects. Okay, so that is why the thing. But we can monitor the patient who is on clozapine and we can reduce the other side effects. And the psychiatric effect is best in clozapine. Okay, so the side effects are he or she can have a sialoria, dyslipidemia is there, then seizures might happen. Then main thing is agranulocytosis and myocarditis. That is why we'll have to keep taking the lab values, and even before giving clozapine also this thing has to be ruled out, that is agranulocytosis, WBC counts and all. Okay, that is with respect to clozapine. Okay, then coming to risperidone, he or she will be having prolactinoma. Okay, so he might develop prolactinoma. Okay, then coming to haloperidol, that is a typical antipsychotic. The main side effect will be extrapyramidal symptoms. Okay, it mainly acts on the basal ganglia and dopaminergic pathway, right? So that is why extrapyramidal symptoms might be there, like for example Parkinson's and all. It might happen. Okay, not Parkinson's, but not definite Parkinson's, but it might cause the symptoms just like Parkinson's. Okay, so this is with respect to haloperidol. So that is all you should know with respect to antipsychotics. Okay, antipsychotics, this is just before you going into exams, so please do not confuse about this. Then coming to mood disorders. In mood disorders, I'll right now explain you what are these mood disorders and all. But now let us see the drugs first. Okay, so in mood disorders, mania, depression and bipolar. Mania meaning hyper. Okay, so hyper, they'll be acting like a hyper person. Okay, whereas depression will be, we all be depressed, right? So we all are depressed right now also because of the exams, right? So this is how the depression will go, and there will be low mood. Okay, high mood is mania, whereas low mood is depression. Bipolar, they can switch between the moods. Okay, so this is what bipolar means. Okay, now let us see depression will be giving antidepressants, right? So there are different types of antidepressants. The important ones to be focused are SSRI, that is selective serotonin reuptake inhibitor, then tricyclic antidepressants, and then there is SNRIs. Okay, serotonin and noradrenaline reuptake inhibitors. The thing is, in depression, basically the serotonin is low. Okay, so the serotonin level is low. Serotonin maintains our mood and all. Okay, so if it is low, we'll be depressed. So what we are trying to do with respect to management of depression is that, so that is why if we start increasing the serotonin level in our brain, so that is how we can avoid depression, right? So that is the main action. So that is why selective serotonin reuptake inhibitor, meaning we are inhibiting the reuptake of the serotonin, so that it will allow the serotonin to stay in the brain itself. Then coming to SNRI, here we are targeting both on serotonin and noradrenaline. So adrenaline is we know that, right? Sympathetic activator, all hyper function and all will happen. So vasoconstriction and all. So it might elevate the mood also, right? So that is why serotonin and noradrenaline reuptake inhibitor. Okay, so this is these are the new drugs that we are using. Okay, so let us see one by one. So in SSRI, the best example that you want you have to remember is fluoxetine and escitalopram. These are the most important drugs that are being used in our OPDs, right? In OPDs of psychiatric OPDs, these are the best drugs that will use with respect to depression. Then tricyclic antidepressants. Here main is we are targeting on the noradrenaline and 5-HT. Okay, 5-HT reuptake inhibitor. Okay, so this is what the TCA. So amitriptyline, all these things will be used in depression. Okay, so remember, right? Then coming to SNRIs, it is the reboxetine. Please remember reboxetine, because it is also used in ADHD. Okay, attention deficit hyperactive disorder, remember, right? So in kids and all, it will be there. So that is why reboxetine is very important. Okay, it is a new kind of drug, please remember this, reboxetine. Okay, then atypical antidepressants and all are not much of an importance. Okay, then with respect to the side effects, basically in SSRIs, infertility might be one of the side effect. Okay, so that is why we will be giving cyproheptadine as a antidote with respect to SSRI toxicity. Okay, cyproheptadine is the antidote that we are giving for SSRI toxicity. Okay, sometimes SSRIs might go into toxic because someone might have ingested too many tablets and all. So we'll be using cyproheptadine. Okay, please remember that. Then coming to bipolar disorders, so that with regards to mood disorders, we are done with the depression. Now with respect to bipolar disorders, the best treatment that we'll give even today will be lithium, right? So lithium is what we prescribe, right? So this is used for bipolar disorders. It might lead to lithium toxicity. Lithium is very, very bad in, it is a teratogenic also, right? So we should avoid lithium in pregnant ladies. So teratogenic, okay, teratogenic, it might affect the neural tube, it might cause neural tube defect. Okay, neural tube defect, we learned, right, all the things with respect to neural tube in neurology. So that is the thing. Then there might also be lithium induced hyperthyroidism. Okay, hyperparathyroidism, which might lead to hypercalcemia. Okay, hypercalcemia in the body. Okay, so this is the thing with respect to lithium. Okay, so with respect to the organic disorders, I told you, right, delirium, dementia and all. So let me now tell you about all the basic disorders and how now we learnt about all the drugs. Okay, let us now dive into the basics of certain disorders. Okay, so that even if you don't know how to answer, you should at least be able to click an option, right? So that is how we should know. Okay, so now what is the difference between delirium and dementia is that in delirium it is going to be an acute onset. Okay, acute onset will be there, and there is loss of awareness. Okay, there is no awareness. Delirium, we will lose the awareness. Okay, whereas in dementia it is a chronic thing. Okay, dementia in Alzheimer's and all, it won't be acute, right? It is going to be chronic thing. In Lewy body dementia and Pick's disease and all, it is going to be a long term, right? So it is going to be chronic, and there is no loss of awareness. Awareness will be normal, they can do their everyday function, but it will be diminished, right? So that is why dementia. Okay, so this is the difference between delirium and dementia. Now coming to, now the organic disorders are done. Now let us go on to the functional disorders one by one. So the important ones only we'll be discussing. So now with respect to mood disorders, it is the bipolar disorders we are supposed to know. Okay, bipolar disorders, I told you, right, it is going to be both maniac disorder and the depressive disorders will be there. So maniac or hypomaniac and the depressive disorders will be there. Okay, so the mainstay of treatment will be lithium therapy. Okay, so that is the thing with respect to bipolar disorder. Okay, so now let us go for schizophrenia, the other type of functional disorder, schizophrenia. Here the main thing is all the delusions and all will be here with respect to schizophrenia. Okay, hallucination, delusions, disorganized speech and behavior, all these things are positive symptoms. Okay, whereas the negative symptoms will be affective flattening, allogonia, okay, and social withdrawal. Okay, so there is no they won't go to the meetings and all. Okay, wherever the people are there, they try to avoid this thing, avoid people, because they will be delusional. Okay, so thought repeating, all these things will be with respect to schizophrenia. Okay, so schizophrenia is where we use antipsychotics, right? So all the antipsychotics and all, just one now we discussed, right? Those are the things. Then coming to one of the most important ones is alcohol withdrawal. With respect to psychiatry, alcohol withdrawal management is very important. Okay, so let us see one by one. So initial withdrawal symptoms would be tachycardia, hypertension, hyperthermia, diaphoresis, and all these things, anxiety, and all will be there. Okay, this happens just after 6 to 8 hours after he stops drinking. These are the initial withdrawal symptoms. Okay, then occurs the hallucinosis. Okay, which will be around in 12 to 24 hours. This is where they come to the hospital, right? So this is where they try to come to hospital. Okay, they wouldn't be able to control these things. Okay, then in hospitals there might be withdrawal seizures, or in home only if they do not come to hospital at this stage, there might be withdrawal seizures also. Okay, which might feel like it is a generalized tonic clonic seizure, and all will be there. Okay, so just like GTCS only it will be there. Okay, then delirium tremens. Okay, so delirium tremens is where it happens after 3 to 5 days of the after the withdrawal of alcohol. Okay, so someone who is a chronic alcohol finally decides to stop alcohol. This is all the things that might happen after the withdrawal of the alcohol. Okay, so this is a very rapid onset, and fluctuating disturbance of attention and cognition will be there. Okay, so this is the thing with alcohol withdrawal. So let us see how do we manage. Suppose the patient has come, and how do we manage. Okay, so what we do is, suppose I told you, right, they'll either come in seizure stage or in the alcohol hallucinosis stage. Okay, so what we do is we'll check for the hypoglycemia status first, and then first thing we do is thiamine. Okay, thiamine, and then the dextrose. We also discussed in the other chapters, right? So first thing that we are going to do is thiamine infusion, and then we'll give dextrose. Okay, then the acute management of tremors will be lorazepam. Okay, so if seizures are there, we are going to go for lorazepam. Okay, then the long-term management of after all this acute management, what we are going to do, we are going to give the prophylaxis, right, to stop all this alcohol withdrawal, or to avoid again to relapse back into alcohol ingestion. Okay, so that is why we'll give disulfiram fomepizole. Okay, fomepizole is an antidote. Okay, so antidote that we use in patients with alcohol, like whoever takes a long term alcohol, and he has to be treated acutely along with thiamine dextrose first after we treat the tremors and all. So it is the fomepizole that we give as an antidote to treat alcoholism. Then disulfiram is what is given as a prescription to for long term alcoholics, to make it like a hangover like symptom. Okay, so that they will start avoiding the alcohol. Okay, so these are certain of the alcoholic disorder related things. Okay, then coming to eating disorders, they are asking these eating disorder things. Okay, so the things are anorexia nervosa, bulimia nervosa, then binge eating disorder, and avoidant restrictive food intake disorder. Okay, so let us see one by one. Anorexia nervosa is where the people try to avoid or restrict the food intake. Okay, because why do they do that is they think that they are fat, or they think that that might increase the fat in them. Okay, so that is what anorexia nervosa means. Okay, then coming to bulimia nervosa, it is basically they'll binge eat. Okay, so binge eating will be there. Okay, and unhealthy behavior also will be there. Okay, but what they do is they'll try to they avoid the food suddenly by like gagging themselves and all. So they'll prevent the weight gain. Okay, so like forced vomiting they'll do, or use laxatives to make all this. They'll eat too much, and they think that okay, this is making me gain weight, so they'll try to avoid this. Okay, that is the bulimia nervosa. Please differentiate between anorexia nervosa and bulimia nervosa. Okay, binge eating disorder, we all do this, right? Netflix and chill. Okay, binge eating disorder, all of us are doing right now. That is the thing. Okay, so we start eating each and everything. Here in ARFID, so it is going to be the amount of food they eat will be variant. Okay, so they will be health conscious, and the amount of food that they eat will be very less in that way. Okay, so that is the thing with ARFID. Okay, now coming to panic attacks, I told you, right? So one was psychosis, the other one is neurosis. Okay, with respect to neurosis, you know, OCD and all, need not tell anything about OCD, phobia also we need not. But anxiety and PTSD, okay, so with respect to anxiety, you are supposed to know is anti-anxiety disorders. Okay, so what we do is we'll try to give benzodiazepines. Okay, so we'll give benzodiazepine at a lower dose in diazepam, lorazepam and all. Okay, uh, and also we'll also give alprazolam, right, an anxiety disorder to induce sleep. At least like they'll tell I'm having anxiety and I'm not able to sleep and all. We'll be prescribing alprax. You remember, right? Alprazolam. We used to give it in OPDs, right? So this is alprazolam. Okay. Then coming to benzodiazepine, here itself I'll tell you, benzodiazepines we use it as as anti this one, right, anti-epileptic drug and all. So the flumazenil can be used as an antidote for benzodiazepine toxicity. Okay, see, remember, don't confuse fomepizole with flumazenil. Okay, flumazenil is for benzodiazepines toxicity, whereas fomepizole was for alcohol antidote. Okay, so it is used as an antidote for alcohol, whereas flumazenil is for benzodiazepine. Okay, both are depressants. Okay, so please remember, benzodiazepine is also a depressant, whereas alcohol is also a depressant, but the antidotes are different. Please remember that. Okay, you can correlate this with your FMT also, toxicology. Okay, then coming to PTSD, so the two major difference that we might go wrong in our questions is with respect to PTSD and acute stress disorder. Okay, so the reason is, in acute stress disorder, if we see the question, all and everything, just by seeing the question, trauma or some car accident was there where she lost her father. After that, she started developing depression like symptoms and all. She started avoiding public and all. So this thing will be there. Suddenly we'll think, oh, okay, one trauma is there, so that is why PTSD, okay, post traumatic stress disorder, is what we'll go and we'll tick off that particular option. But no, please remember, in PTSD, the symptoms will be after 1 month. It will be more than 1 month. Okay, after all this trauma and all, after the 1 month, and it will be persisting more than 1 month. Okay, if that is given in the question, it is PTSD, or else it is going to be acute stress disorder. Okay, so if it is just right after the incident, if the symptoms are there, it is going to be acute stress disorder, and it is going to be almost like for 1 month. Okay, so more than 1 month if it is there, it is going to be PTSD. Please try to differentiate between acute stress disorder and PTSD. Okay, so that is all I can teach you with respect to psychiatry. If you want to do, please go do some question banks with respect to psychiatry. Okay, so then you will be knowing what other points that should be added. Okay, so it is based on all the drugs and the side effects of it only. Okay, with respect to psychiatry, and some other things are like to identify what particular disease that the person is going through, all the cognitive behaviors, that particular DSM criterias and all these things they'll be asking. Okay, that's it. Okay, thank you with respect to psychiatry. Thank you.